Our next story takes us to Stony Brook Children's Cancer Center, where we find a true hero, a woman who works both on and off the clock to bring smiles to the faces of cancer patients receiving treatments and their families.
Shall we check our box of tricks? Here's your ball that you wanted.
That's Lauren Sharaby. She's a certified child life specialist here at Stony Brook Children's Cancer Center. Today she's helping 7-year-old Jesse, who has been a patient here since he was just 4 years old. Jesse was diagnosed with acute lymphoblastic leukemia, and unfortunately much of his young life has been spent here at the cancer center.
Are you a superhero?
Yes, I am.
Jesse was only 5 months away from finishing treatment when he relapsed. Once again, high-dose steroids and aggressive chemo treatments are doctors' orders. It's tough on Jesse and his mom, Fariba, who remains by his side throughout.
When we come here, it's a relief. This is the only time I get to sit down and not worry about him.
Not having to worry, all thanks to one person, Miss Lauren. Even on the worst days when Jesse is upset and crying, Fariba simply labels her magical.
Lauren is it's like this medication, this power that just takes the pain away from the kids. And he's happy, he loves it, he loves Lauren. And the first thing he asks when we come to clinic or hospital, where is Miss Lauren?
Candyland it is. You know, they come in, they have to see doctors, they have to take medicine. I'm there to offer them choices. They don't really get many choices when they're sick. They get told they have to go see the doctor. They get told they have to miss their school trip. And I'm there to make it better.
But like many of the children she works with, Lauren is all too familiar with frequent hospital visits as a patient. She was born with a craniofacial abnormality called Cruzon syndrome.
I remember going to the hospital myself, and every time I would have to go, my parents would say, "Don't worry, you're going to see Marianne, and she's going to be there to play with you and make you happy." What color do you want to be?
And today she's what Marianne was to her, as well as to so many other children.
We were so nervous, we thought it would be very scary for her, and instead she had a great time because she had amazing toys to play with. She had Lauren here to distract her.
Athena loves Snow White, playing pretend in the kitchen, and even receives chemotherapy treatments as frequent as every 2 weeks.
This has totally turned it into something positive, which I know sounds crazy considering it is cancer and it's scary, but she loves coming here and she knows everyone here, and she's not afraid.
Closets filled with games, special activities, and let's not forget the treasure chest.
Okay, let's see what we can find. I mean, you met some of these kids and some of these families. Wouldn't you want to do everything you could to make their day better or help them through a difficult procedure? I can't stay away.
And so that's why Lauren shows up even on her day off.
My job here really is to help the patients and the families whichever way I can. Some people would say I wear many hats. As you saw today, I helped Jesse with his finger stick. I painted one of the teenage girls' nails. Whatever I can do to make them happy, make the time go by faster. Some of these kids are here for hours. Some of them come in at 8 and don't leave till 6, so it's a long day for these kids getting medicine. So really just trying to bring excitement and joy to them while they're here.
But it goes well beyond that. Lauren even provides procedural support by keeping the kids' minds on other things. She schedules special visitors, like members from the New York Islanders hockey team. But that's not all.
I also celebrate milestones with these kids, which is one of the most exciting things I think that I do. Some of these kids, unfortunately, they don't make it till their next birthday. So we have birthday parties here for the kids, and they get to pick out their theme and what kind of cake they want, and we wrap presents, and all the staff comes out and we sing happy birthday, and they get to blow out candles just like a normal kid would do. I really just try to normalize the hospital experience and illness, really. No Band-Aids, right? No Band-Aids.
I speak for myself, and I think for a lot of other parents. Without Lauren and Child Life, it's very hard for families to deal with these things, and the kids feel it. They come in, Lauren comes in with this whole magical power that she has and just calms them down. And we're able to walk away and try to calm ourselves down.
But when it comes to the heroes, Lauren doesn't like to attach such a label to herself.
The heroes are the kids, of course. These patients and these families, I mean, they are hit with such hard news, devastating news sometimes, and you just watch them grow and swim, basically, and all of these families swim. They swim hard for their kids.
This summer, the Cancer Center will be bringing in Sunrise on Wheels, a traveling camp so that children receiving chemo can still experience the summer fun that most kids their age get to have.